Hello, everyone, and thank you so much for joining us tonight. I'm so glad to have our amazing speakers and to have all of you with us for this great topic. My name is Leanna Bennett, and I'm the walk manager with the Lupus Foundation of America. I oversee the DC, Maryland, and Virginia areas. I'm here to be a resource for all of you, so please do not hesitate to reach out during or after this program with any questions. First, I would like to thank our presenting sponsor, Aurinia. Aurinia is such a wonderful partner and supporter of the LFA and the lupus community. I'm also so thrilled to have Nicole Shaban from Aurinia with us here and part of today's program. Before we begin, I have a few housekeeping items to go over. If at any time you have any general questions that we'd like to submit to our speakers, you can add those to the chat. We will have time at the end where speakers will answer those questions. Don't forget to keep your mic muted. Keeping yourself muted will keep the flow of the program from being interrupted and save more time for questions at the end. Finally, this program will be recorded and you will receive a link of the recording along with some of the helpful resources and a post-event survey at the end. Now, a brief overview of our agenda. I will kick us off by sharing more information about the Lupus Foundation of America and some helpful resources and ways you can get involved. We have two amazing lupus warriors joining us tonight to share their story and experience, and other amazing speakers like Dr. Timlin and Nicole Shaban, and again with the Q&A at the end. So now let me get started on more information about the Lupus Foundation of America. Here at the LFA, people affected by lupus represent the heart and soul of our foundation. You are the central focus of everything we do and are a constant reminder of our mission's urgency and serve to motivate us to continue this fight. To put this simply, our goal at the Lupus Foundation of America is to one day end the impact of lupus and its suffering while ensuring that we provide the comprehensive support and programs people with lupus need today. Sorry, just letting a few more people in from the waiting room. Our programs stand upon three pillars: research, care and support services, and advocacy. We have redefined lupus research to expand our efforts beyond just funding research grants. We are engaging all stakeholders to identify barriers that stand in the way of progress and setting a course to overcome them. And we do this by providing caring support for people affected by this devastating disease and leading advocacy efforts to bring more funding for research and services. Our research is patient-centered and focused on transforming lives. We have three goals: identify the causes of lupus, discover better ways to control symptoms, and ultimately find pathways to cure lupus. We've made significant progress in lupus research, but we are far from over in our quest to solve this cool mystery. No one understands lupus better than those living with it, and researchers need your help. You can help advance lupus research right from the comfort of your home when you participate in our new online research platform, RAY, which stands for Research Accelerated by You. Share your experiences with lupus to help inform future clinical trials and new treatments. Identify the most pressing needs of people with lupus. So head to lupus.org/RAY to learn more and sign up today. Another program is SELF. SELF is a free online self-management program designed to help people with lupus live their best life. SELF can be a virtual coach to help you manage your symptoms, manage your stress, work with your healthcare team, and manage your medications. It's convenient and customized to your needs. SELF is also now a mobile app to be an even greater tool to you. So head to lupus.org/self to learn more about this program or download the mobile app today. We also have a National Resource Center on lupus, which can be your one-stop resource for all things. So you can head to lupus.org/resources to find this information so you can make informed decisions about what is right for you. We also have certified health education specialists who are trained to provide people with lupus, their families, and caregivers with non-medical counseling, disease education, and helpful resources. Our health educators can help you find trustworthy information to answer your questions about lupus and how to cope with it. To contact a health educator, fill out our online form at lupus.org/health educator. Next, we have a program called Take Charge, which is a 12-week education email series for people with lupus, including those recently diagnosed. When you sign up, you'll get an email from our health educators with tips and resources that can empower you to take charge of your health. The series covers important topics such as identifying and tracking your symptoms, sticking with your treatment plan, and getting the most out of your doctor's appointments. We're also so happy to offer this program in Spanish. And you can head to lupus.org/takecharge to sign up for this program today. We have so many other programs at the LFA that I encourage you to check out on our website. I'd be happy to share more information with you if you would like any additional follow-up materials. Also on our website, you can find our support groups. We have more than 150 support groups across the country where people with lupus can come together, ask questions, and listen to each other. Many of these groups meet in person and virtually, so I encourage you to find a group that works for you. You can also get involved through advocacy. We are the leader in stimulating federal support for lupus. Every day, we fight to ensure the government is responsive to the needs of the 1.5 million Americans living with lupus. This photo is actually from earlier this year, where hundreds of lupus advocates joined as we gathered for the largest lupus advocacy event in the nation. We learned from experts in the field about the latest in lupus, and we got to meet with members of Congress to urge them to join us in the fight. It's such an amazing few days of advocating and meeting people from across the country. If you're interested in learning more about this event or ways you can get involved in advocacy, head to lupus.org/advocate and stay tuned for updates about our 2024 Advocacy Summit. Finally, you can get involved through our Walk to End Lupus Now program. Whether you choose to walk virtually or join us in person, we have walks all across the country. Because I support our DMV area, I oversee our DC, Baltimore, and Richmond walks. This season, hundreds of walkers attended walks in their community, rallying local support and raising awareness for lupus, all while raising funds that go towards lupus research and programs. Here are some amazing photos from DC that took place in September. If you have any questions about joining walks locally or wherever you may be, I'd love to share more information with you. Plans are already making way for 2024, so please let me know if you'd like to get involved or if you have any questions. To close out my talk, and thank you so much for your attention, this is where you can find us. So check out our website, follow us on social media. It's a great way to stay updated on all the programs and events and services that I mentioned today. I can also follow up with any specific information that you may need or any specific resource that you'd like to learn more about. And with that, I'm so excited to introduce our first lupus warrior to share a little bit about herself and her story. I've gotten to know her throughout this year, and I'm so excited to have her share a little bit more about herself. So Mandy, I'll turn it over to you.
Thank you, Leanna. Hi, everyone. My name is Mandy Remmel. I am a lupus warrior, which is amazing to say. It's been a new title that I have been navigating for the last year now, and it's come with its highs and lows, its ups and downs. But I'm excited to continue to go through this journey with the support team that I have been able to have. So just a little bit about myself. I was born and raised in Baltimore, still true to a Baltimore County girl. I started in 2021 noticing, maybe a little bit before then, noticing some issues with hives and night sweats and fatigue and joint pain. And I couldn't really put my finger on it. I was going to multiple different specialists, from gynecologists to the allergists to everyone in between, my primary care physician. And it just so happened that my allergist at the time said she was going to do some additional blood work in the autoimmune area. And if anything came back positive, we would talk about it. And that is when I did actually have some positive blood work, which then sent me over to a rheumatologist. So after kind of going through the motions and doing all of the the lab work and the blood work and the word lupus kind of being thrown around, and starting hydroxychloroquine, I said, if this is lupus, I really need I really need to know, like, I know, after all of my research online, it takes about 6 years for a true confirmed diagnosis. But my primary care physician at the time said, there's one person you need to see, and that is Dr. Homa Timlin, who I'm so excited everyone gets to actually talk to tonight, because she is the only lupus specialist at Johns Hopkins Bayview. So I was fortunate enough to get a chart review with her and, actually be accepted into coming to see her for a consultation. And after meeting her, and I think Dr. Timlin, we were together maybe almost 2 hours in our first initial appointment. But she listened, and it felt as if I wasn't crazy, all of these symptoms, all of these different things that I was experiencing, the joint pain, the locations, the hands, the swelling in the wrists and the feet and the elbows, and all of those things really paired with my lab work, and the nasal ulcers and the mouth ulcers, it was lupus, right? And I think that's what a lot of us as warriors are continuing to, not that anybody wants a diagnosis of a chronic health condition, but it set the foundation for me to have such a supportive provider like Dr. Timlin, to be able to really start this process. So as I'm newly diagnosed, it's a year in December. I think it's December 16th is my official 1 year anniversary. I've just been, it's been a great journey. It's had its highs and lows, but I would say the best thing that we can do as warriors, if I had to give any advice, is continue to be honest. Be honest with your provider. Share what you're feeling. And as Dr. Timlin has said, multiple times, do not hesitate to reach out if something, is wrong. And now, and for Dr. Timlin's office, we have an opportunity to do, messaging on a portal, and just having a physician that is a partner in this, right? They're part of your journey. They're part of your life really now. And that's just been such a blessing for me as a lupus patient. So I would continue to share to advocate for yourself. And again, no symptom is too small. Bring it up to your physician and continue to work through your care plan. I would also say, take your meds. If you are diagnosed with medicine, make sure that you are compliant in your medication, and ask questions. And we as warriors, and thrivers, I heard that word the other day on a lupus panel, talking about ourselves as thrivers. I think even Nicole says thrivers, but as thrivers, we really have to, speak up for ourselves. If something maybe doesn't make you feel right, or if there is something that you feel, isn't doing everything it needs to do to help you on your journey and with your symptoms, talk to your physicians. We are really in this together, and they are the experts to really help, help us through and navigate through this. So I'm excited to be here tonight and happy to just share a little bit about my journey on this lupus journey.
Thank you so much, Mandy. It's always so great to hear your perspective, and we've only known each other for not even a year, but it's been such a pleasure getting to know you and watching you really become such a leader in this space. So thank you so much for joining us tonight. And please, if anyone has any direct questions for Mandy or just wants to chat with her, please throw anything into the chat. I'm also so thrilled now to go to our next amazing lupus warrior to share a little bit about herself. I am just now meeting her tonight, but she has come with brave recommendations from Dr. Timlin. So I'm so excited to learn more about her and have her have the opportunity to share a little bit about herself. Nancy, I'll turn it over to you now. You are muted. Just wanted to.
There we go. We're good to go. Hello, everyone. I'm excited to see everyone today. Well, I am a patient of Dr. Timlin, so I thank her for how I feel today. But before I tell you how I feel today, I want to tell you how this started. So it was the Friday before Memorial Day weekend. I will never forget. I was laying in bed with my 8-month son at the time, and I had a fever. So I thought, hey, I have a fever. It might be an infection. It might be a virus. My body will take care of it. But what happened after that Friday was the fevers never stopped. I continue having a fever every single day. And the fevers got worse and worse, and my body felt weaker and weaker. My ears started getting purple, and my face looked like I had severe acne. So I knew something was wrong. I immediately went to go see my primary physician. Primary physician ordered tons of lab work, but this is during COVID. So everything was delayed. Getting an appointment was delayed. I couldn't wait any longer to get blood work results. So I immediately rushed to the ER, to the nearest hospital. I was hospitalized for 4 days, and I was misdiagnosed. They told me I had the shingles. They told me I had a stomach virus that was contagious. I get discharged with the wrong medications. After getting discharged and being at my parents' house at this point for 3 days, I lost my appetite. I pretty much, to sum it up, and I'm sure a lot of you will relate, I wanted to die. I had no more strength in me. I felt that it was just easier to pray to God to take me than to continue. When my husband saw that I didn't want to eat anymore and I didn't want to interact with anyone, he pretty much forced me to go to Johns Hopkins. And that's what changed my life. Why? Because I went to the right place at the right time, and I met the correct and the right care team. That's where I met Dr. Timlin. After that, I'm not going to lie, I was at Hopkins for almost a month, and it was a long journey. It took about 5 to 6 months for me to feel like I was getting better. But I will tell you it was worth it. Why? Because Dr. Timlin took care of me. She's been with me through my high and my lows, and I followed everything she has asked me to do. I'm very disciplined. So the message I want to give everyone today is that it's very, very important that you build a relationship with your doctor and don't give up, because trust me, in those 5 months that it took me to feel better, I lost my hair. I went completely bald. It took a toll, a huge toll on my self-esteem, because my face was purple, my face was swollen, and I was bald. COVID saved me because I was able to wear a mask and I was able to cover my hair loss. And I'm sorry, I might get a little emotional, but I will tell you that I sit here today and for 2 years, I feel like I'm the old Nancy prior to having lupus. I feel like I'm not a lupus patient. I have all the energy to deal with my 3-year-old toddler. And this is due to my amazing rheumatologist, and also because I have taken charge. And it starts with us, guys. It starts with us. Sometimes we feel that, hey, it's not going the right way. What's going to happen? Am I going to die? But no, if you have the discipline and you build that relationship with your care team, trust me, it is worth it. And I feel good today. Not too long ago, I had asked Dr. Timlin if I could try to have a baby. She never said no, but she didn't say yes. And this year for my birthday, she gave me the great news that I could. So this is a great example of how it pays off. It's worth it. So let's continue the fight. We can do this together. Thank you so much.
Thank you so much, Nancy. That was such an incredible story, and really just great advice about taking charge of your health and advocating for yourself and really working with your team. And I'm so glad that you and Mandy have Dr. Timlin and have this great relationship with her, because I think that's just so important in your care. And thank you both for joining us here tonight. And I think now it's the perfect segue into going into Dr. Timlin's talk. So I'm so excited to introduce Dr. Timlin. So Dr. Homa Timlin is an assistant professor of medicine at the Johns Hopkins University School of Medicine and the only lupus specialist at Johns Hopkins Bayview Medical Center. Her areas of clinical expertise include SLE and lupus nephritis. For more than a decade, Dr. Timlin has dedicated her clinical practice to treating patients with the most complex lupus nephritis and helping them avoid hospitalizations due to lupus flare-ups. As the medical chair for the local chapter of the Lupus Foundation of America and a longtime partner, she supports the DMV region with educational programming for patients with lupus and their families. So Dr. Timlin, thank you so much for being here, and I'll turn it over to you to share your screen and get your presentation started.
Can you hear me?
Yes.
Hello, everyone. Thank you so much for inviting me to present lupus nephritis, and it's so lovely to see all familiar faces. So the purpose of this presentation is to provide an insight into what lupus and lupus nephritis is, and how our kidneys function, and what treatments are available. So I have no disclosures, but I will be discussing some medications that we have been using to treat lupus nephritis.
Dr. Timlin, we can't see your screen. We can see you though.
Oh, really? I'm so sorry. Let me go back. I'm so sorry. Should I go back?
I think you just need to restart sharing your screen, and then we might be able to see it.
I am so sorry.
No worries.
It doesn't. Oh, here it is. Okay. Let me know when you can see.
There you
It's
go.
perfect. We're on your disclosure slide. Perfect.
Excellent. Thank you. So let's look at what is exactly lupus. So when your immune system attacks your body, this can lead to a range of symptoms. They can be variable, benign, and life-threatening. Lupus may affect one or more parts of the body, including skin, muscle, joints, lungs, heart, kidney, brain, and blood cells. So as you heard earlier, it is so important you advocate for yourself. So monitoring symptoms should be a team effort. And it is so important to have a good communication, because good communication is essential to ensure that you get the support you need. So it all starts from you, and of course your lupus specialist, and specialty consultation, regular visits, lab monitoring, and taking the medications regularly. So there are two kidneys, each of which connects to the bladder via ureters. So kidneys filter blood to clean out waste products. They remove excess water and regulate fluid balance. They balance electrolytes such as sodium, potassium, phosphate, magnesium. They also play a role in hormone regulation like vitamin D or erythropoietin. Here's how the kidney works. So remember, each kidney contains approximately 1 million nephrons. So each kidney contains 1 million nephrons. Nephrons are the functional units of the kidneys, consisting of a glomerulus, this one, and then a tubule. The glomerulus filters your blood, and the tubule removes waste products called urine. So this is how it works. Unfiltered blood comes to the kidney, goes to this glomerulus, gets rid of the waste products, and the good filtered blood goes back to your system. So what is lupus nephritis? Inflammation in the glomeruli of the kidney causes leakage within blood vessels. As a result, the kidney becomes less effective at doing their jobs, such as filtering blood. So patients may not have any symptoms or can have severe symptoms, end up been hospitalized. They may see swelling in their legs, high blood pressure, blood in the urine, bubbles in the urine. That's why it's so important to get evaluated. So when we see you, we will check your blood pressure to see if it's elevated. We examine joints to see if there is any swelling. We look for lupus rash, fluid in the lung, or any swelling in the legs called pitting edema. Then we request some tests that includes blood count to look for anemia. Creatinine is a marker of kidney function. We check lupus labs like double-stranded DNA, complements, and of course we look at urine tests to see if there is any blood or any protein. So the gold standard for diagnosis of lupus nephritis is a kidney biopsy. It's normally done by nephrologists, either ultrasound guided or CT guided, which is low risk. So the color changes on the tissue biopsy reflects the amount of cells deposited in the glomeruli of the kidney. The biopsy helps us to determine the severity of lupus nephritis based on the classes. So there are 6 classes of lupus nephritis. 6 classes of lupus nephritis. Class 1 and 2 are mild. Class 3 called focal glomerulonephritis. Class 4 is called diffuse glomerulonephritis. Class 5 is membranous glomerulonephritis. And class 6 is basically scarring. And at this stage, patients will require dialysis and they will be referred to the transplant team. So this is how a tissue biopsy will look like under the microscope. So this is class 1, class 2, class 3, class 4, and class 5. As you see here, increased color means increased inflammation. So how do we treat lupus nephritis? It really depends on the biopsy, and the severity of the disease. We consider a short-term medication called induction, followed by a long-term medication called maintenance therapy, for a total of about 2 to 3 years. It is so important that every lupus patient takes their hydroxychloroquine. Why is that? Why hydroxychloroquine is so important? Plaquenil or hydroxychloroquine reduces flares, organ damage, reduces lipids, thrombosis, prevents seizures, triples mycophenolate response, and is the only medication that has been proven to increase survival. We use steroids for class 3, 4, 5 lupus nephritis. Steroids works quickly, and remember they suppress adrenal glands. So if you decide to stop your steroids, you must let your rheumatologist know. It's given either through infusion or tablets, but because of multiple side effects, we try to limit use of steroids. The side effects include increase in risk of infections, obesity, thinning of the bones, thinning of the skin, osteoporosis, diabetes, high cholesterol, cataract, glaucoma. For that reason, we use steroid-sparing drugs. Other immunosuppressant medications such as mycophenolate or Cellcept. This has been used for class 3, 4, and 5 lupus nephritis. Many patients can tolerate Cellcept well. Some may have GI upset, but this medication was never be used throughout the pregnancies because it can cause fetal malformation. CellCept is also useful for other manifestations of lupus besides kidneys. Another medication called Imiran or azathioprine. This medication is safe throughout the pregnancy, but you need to have regular lab monitoring to check for any side effects, such as low white blood cell or elevated liver function test. Other immunosuppressant medications include cyclosporine or tacrolimus. Cyclosporine can cause swollen gums or elevated blood pressure. Tacrolimus can affect kidneys, elevated potassium. For both these medications can be used with mycophenolate. Rarely used Cytoxan is given either via infusion or tablets. So the infusion is either every 4 weeks, that's the NIH protocol, or every 2 weeks, that's Eurolupus. Cytoxan has multiple side effects, including GI, like nausea, can cause bladder cancer. That's why we give a medication called Mesna during the infusion. Can also cause premature ovarian failure and fetal malformation. So a medication is absolutely contraindicated throughout the pregnancy. Rituximab is also infusion. It's given 2 doses over 2 weeks. Patients can continue other medications such as hydroxychloroquine and mycophenolate. Rituximab, like other immunosuppressant medication, can dampen the immune system and increase risk of infections. And it is important that you are accompanied by a member of family when you go for your infusions because there is a risk of infusion reaction. The good news is that now we have 2 new medications approved by the FDA for treatment of lupus nephritis. Benlysta or belimumab was FDA approved in December 2020. It's given either once every 4 weeks by infusion or once a week subcutaneously. So it's only in injection form at the moment. Voclosporin was FDA approved about a couple of weeks later. Another name is called lupkinase. And this is in pill form, so there is no injection. Obinutuzumab is more efficient B-cell depleter, but clinical trials are still ongoing. In addition to the immunosuppressant medications, patients need to take vitamin D if the vitamin D level is low. Controlling blood pressure is critical in kidney disease. And some of medications such as ACE or ARB, like lisinopril or losartan, can also reduce protein loss from kidneys. Some patients may require cholesterol-lowering medications or bone protection. But remember, every lupus nephritis patient must avoid NSAIDs. That's like Aleve, ibuprofen. As Liana said, you can find more resources via Lupus Foundation of America. So as always, as I finish, always ask a couple of questions. So here we go. My first question for you. Nephrons are the functional units of the kidneys, consisting of a glomerulus and a tubule that produces urine in the process of removing waste products from the blood. And remember, every time when there is a flare, a lupus nephritis flare, you will lose 1/3 of your nephrons. Once they're gone, they're gone. It's only scarring. So how many nephrons does each kidney contain? Can anyone respond?
1 million.
Very good. Excellent. 1 million. What's the most important medication that all lupus patients should take unless there is a contraindication?
Plaquenil.
Plaquenil, hydroxychloroquine.
Very good. Excellent. Thank you. How many classes of lupus nephritis are there?
6.
6 classes. Excellent. So I know this is going to be a little bit difficult with the pronunciation, but there are 2 new FDA-approved drugs for lupus nephritis. And the hint, one starts with Ben, and the second one starts with Lup.
Benlysta and Lupus.
Fantastic. So Benlysta is either infusion or subcutaneously, and voclosporin or Lupus is just in pill forms. Thank you so much for allowing me to talk to you about lupus nephritis. Hopefully you all found this very helpful.
Thank you so much, Dr. Timlin. I know I always learn when I'm talking to you, so thank you so much. And I love the little quiz at the end of your talk, and I love seeing all the engagement, and great that you guys were all listening and knew the answer to that. So kudos to everyone on the call. I'm so thankful to you and to all of our amazing speakers for joining us tonight, and for all of you joining now, and for anyone who will be watching the recording. Please use this QR code. I would love your feedback. Your feedback is highly valued and really helps me shape future programs. I would love to know what you thought of tonight's event, and I would love to know what other topics or content you would like to see planned for future programs. This is a short survey, and you can use this QR code, and I'll follow up with a link in an email if that is just easier for you. But again, thank you so much, Dr. Timlin, Mandy, Nancy, and Nicole. It was such a great and informative event, and I hope you all have a wonderful evening. And with that, thank you and have a good night.
Thank you. Thank you so much. Thank you, everyone.